We're here with Reggie Levine to learn a little bit more about her and what she does here at A&B and why what brought her to insurance and health insurance. And so let's go ahead and get started. How long have you been with A&B?
Just under a year.
Okay. And have you been with Blue Cross prior or?
No, I've been in insurance for about 4 years.
Okay. What other types of insurance have?
Done life insurance, a lot of Medicare.
Okay.
Supplemental benefits, accident, worksite business.
Okay. What kind of drew you to A&B?
Knew the reputation of the company. Very good company. Wanted to be part of it, and really wanted to be part of doing health insurance and a little bit more variety in the life insurance.
Okay. And what kind of changes have you seen just in the last year in terms of major medical and healthcare reform and everything that's going on?
Just a lot of excitement. I think a lot of confusion, but there's also a lot of excitement about people being able to get insurance who couldn't get insurance before.
Right.
So that's I think that's a good thing. Get everybody some coverage and put everybody on equal footing.
Mm-hmm. And what's your, we keep reading, and I post on Facebook all the time about, 4 out of 10 people just really have no idea what healthcare reform means to them. They don't even know they qualify for a subsidy when they're going to. How do you sort of handle those people? Are you kind of educating from scratch, or what are you seeing and hearing?
Just about that. I'm educating from scratch, really trying to find out where people are at, what they know, and really let them know that they are entitled to benefits that they obviously don't realize that they are. And most of them are really excited about that and looking forward to being able to finally get good coverage and good health care.
Is it kind of a sense of relief when you finally explain to them, hey, here's what it really means? Actually, when you thought you couldn't get coverage or you couldn't afford coverage, here's what we can do.
It is definitely, especially for the people that can afford it. I think there's always a confusion of the people that definitely can afford it and have always had it.
Right.
They're maybe a little bit so on what's going on, but for the people that haven't been able to get involved, they're really excited about it and looking forward to getting coverage for the first time.
Yeah, it is. It's definitely going to be a different world.
Especially with people with major health conditions.
Being able to help those people is very rewarding and gratifying, I assume.
Absolutely, which is why I'm in the business.
Talk about your Medicare experience and what you how you approach it and your experiences and your strategies with helping Medicare clients.
Again, I've been very involved with the senior market from a personal standpoint to start with, just within my own family, and I've seen how beneficial it is to have good and proper coverage in order to get good health care.
You've seen it firsthand.
I've seen it absolutely firsthand. I've been basically helping caregiver and taking care of some of the stuff within my own family, and I've seen with having good insurance how quickly health needs are taken care of.
Yeah.
And how well they're taken care of without having to worry about it.
What are a couple of the major benefits or reasons why, with a Florida Blue, you have Medicare customer, major medical, why are those taken care of so quickly? Is it because the network's so large? Is it because Florida Blue pays? Is it?
With having good insurance, again, it's because Florida Blue does pay. Also, having a large network, being able to, with a supplement, being able to not worrying about any kind of restrictions. With the PPO, the people do have the flexibility to go outside of the state and get whatever coverage they need, and that's really important because if you are diagnosed with something severe, time is of the essence.
How critical is that for the over 65 market, traveling out of state? Because a lot of them do travel, and maybe they don't think about that when they're signing up.
Right. It's very critical because I think, like I said, I've seen it in my own life and in talking to other customers that it seems like something tends to happen when you're not at home.
Yeah, it's weird. Why is that? I mean, it's bad things happen at the worst time.
Exactly. Even if it's a slip and fall, whatever it is, it seems to happen when we're not at home. And,
right.
To be able to know that you can be taken care of takes a lot of stress and worry away.
Yeah, that's a great thing, and again, it's something that people don't. There's a lot of things people don't consider before they get their policies. And what are some of the other sort of misconceptions people might have?
Well, a lot of them, and just not having the proper coverage is nobody thinks they're going to wind up in rehab or in the hospital, and if they do, they don't think they're going to be in there for an extended period of time. But if they don't have the proper coverage, right in the middle of whatever treatment you're getting, the plug can be pulled.
It's
and
unbelievable.
I've seen it happen way too often where the plug is just pulled because people don't have the right coverage, and at that point, there's nothing they can do. It's too late.
There's really no sort of backstop at that point, right?
You're in the downspin.
Your coverage is over. Your coverage is over.
Exactly. But having the right coverage going in, you can concentrate on taking care of your health and getting well, and your family can do the same.
Well, last question. Gaze into your crystal ball a little bit, and what do you see in terms of what happens after January 1? Changes in terms of more people are covered, obviously, but what do you think just in terms of medical coverage in general? What do you think the changes are going to be as a result of reform?
Well, hopefully, like I said, everyone will get an equal footing in being able, the people that do have or have neglected their health care will be able to get more preventative care earlier and maybe treat some of the major illnesses earlier before they become more catastrophic.
Right, and that's a good thing.
And that's definitely a good thing. And also just taking care of the kids and taking the stress off of families being able to take care of themselves.
Right. And that's so important just for the state of mind, well-being,
Absolutely.
Peace of mind. What is best way to contact you? What are your office hours?
I'm here every day, all week.
I can vouch for that. She's always here. I always see her here.
First one in. No, I'm an early riser, so I'm here early. I'm here all day. Weekends, I have no problem working on the weekends.
Okay.
Calling me at the cell phone on my office.
What's that number? What's the cell phone number?
Cell phone is 727-688-7344, or at the office, which is 813-397-5090. And I'm always available.
Great. And all of the rest of Reggie's personal profile information is on the page, so you'll have her email address and everything else. And thanks for sitting down with us for a few minutes. I enjoyed it. Hope you did too.
I did, thank you.
And catch us on the next interview coming up very soon. Thanks.